Matthew Holt. Oscar's got a price. We've got funding deals, and I heard you have bad jokes about some of them. It's the February 23rd episode of Health in 2.0. So, forewarning, and let us pre-apologize in advance for anything that Mr. Holt says within the 2 minutes about your company, the money you raised, people who might work there, what your solution is. Preemptive apology on behalf of me.
They're not rude jokes, they're just bad jokes. Come on. And there's only two of them.
That's a line. I feel like you do not know where that line is very well. Like that is not an easy call for you.
All right. Well, let's talk about the easy calls because the funding, this one is out for Oscar. They think it's going to be about $6.5 billion, which is a lot. And they show who actually owns what. So Alphabet, remember Google put in some money, they own 18%. Founders Fund, I think, owns 16%. And General Catalyst owns another 10%. All Momentum Angel is going to be putting yet more money into the bank. He better find some of that SPAC to buy pretty quick.
Right. Time to spend that money and sponsor our show.
That's the other thing he could do. He could spend some of the $600 million he's going to take out of Oscar.
Maybe he can pay to shut you up. There's a special price for that.
That's probably less than $600 million. All right, you ready?
Here we go. Circulo gets $50 million. Sean Lane, CEO of Olive. This is his new company. It's a managed Medicaid plan that's going to run on Olive's platform. This blew my mind. I didn't see this one coming.
Well, I assume that Sean, with his ex-NSA, NSA connections, has got the goods on a bunch of venture capitalists. It's all the same venture capitalists through Olive, including General Catalyst. So you're going to be worried about all that compliment he's got. I don't know. But look, I mean, it's an interesting idea, right? If you can do AI and figure out how to manage transactions, there's a lot of that in Medicaid. 50 million ain't much to start off with a Medicaid plan. Oscar's shown that if you want to do a health plan, you have to spend a lot more money. So interesting, but how can you run two companies at once? We'll find out.
He had 3 rounds for Olive last year, so maybe he'll raise more. How about Eden Health? They get 60 million. What do you know about this one?
Yeah, I think for 60 million, you could have bought Eden Hazard. You don't know Eden Hazard.
Oh, wait, was that your bad joke?
That's the bad joke. He's a famous soccer player who's not having a very good time. But anyway, this is a online, offline clinic aimed at mid-level employers. Does that remind you of anybody you've heard of that Scott Shreve invented a while ago? Yeah, it does. You're going to see a lot more of this attempts to do this kind of thing. And why not? We'll see how they go. They were more offline, physical. Now they're doing online as well. They were renting out parts of, I think, WeWork at one point. Was that them? Was that somebody else? I can't remember. But go on.
All right, Carevive Systems. They get 18 million. Interesting group of people invested in this. Philips, Cerner, and LRB Health.
Yeah, this is a kind of chatbot plus support for people with cancer when they go home from the hospital or the clinic. I had a Finnish company called Nuna Health doing exactly the same thing at Health a while back, who got bought by Varian, the people who make radiology systems for cancer. Radiation systems for cancer. So why they're different and better, I don't know. I'm trying to find out, but interesting that there's going to be, a lot more support for patients. So that, I guess, is a good thing.
Maybe that's why Philips in it. What about Loyal? They get 12 million. This is consumer engagement for hospitals.
Well, everyone wants to have consumer engagement. And what is this? This is a chat bot plus search for doctors plus, ways to connect with patients. Interestingly enough, let me tell you a real life example of connecting with patients.
Oh, great. Tell me a real life.
A bunch of hospitals in Philadelphia, people have been trying to connect with patients to give them these things called vaccines. You may have heard that there's a pandemic going on and that there are vaccines. And they reached out via the portal, the patient portal, and they got 15% of their target market to come in. They were trying to get sick people, minorities, people over 65 to come in. Only 15% of them showed up, right, on the app, on the patient portal, the My Chart or whatever. And they started making phone calls, and within 3 phone calls to each person, they got up to 70%. That's more for seniors. So yeah, there is a big problem for providers connecting with their patients in all kinds of different ways, for all kinds of important reasons. And maybe Loyal will do something about that. A lot of other people are trying, and probably nobody's really succeeded yet.
Well, let's wish them some luck.
Let's wish them some luck and hope they get some patient loyalty. That was terrible.
Wow, those jokes were bad.
I'm not getting paid enough for my jokes to be good or to hire a writer. So, you know.
Oh my God, you can make an effort though. That's free.
That one I just made up on the spot. I thought my Eden Hazard joke was great. I actually was going to tweet about it. I did tweet about it this morning. I was going to tweet about it last week when I saw it. My tweet didn't go out. But
and so we're suffering here for that.
No, Skip Freshman liked it because he understands soccer and health. Yeah, there are like 3 of us who know about soccer and digital health. And
we need like a joke explainer. If somebody can just explain your jokes to me and why they're funny.
well, yes, I can't afford that person either. Can't afford the writer. Can't afford the joke explainer. Maybe when Hamad Taneja sponsors the show,
there you go.
Put some of the funds towards the joke explainer, the joke writer. In fact, basically, I can be taken out of it. You can have the joke.
We should crowdsource this on Twitter. In fact, let's do that. If you want to send some jokes over to Volty Boy, he needs them. You can find him on Twitter there, or you can send them to me, and then I can start throwing some jokes around. I'm at Jess DaMassa, and be sure to sign up for our cute little email newsletter and get these Health in 2.0 episodes delivered directly into your inbox. Just go to thehealthcareblog.com and sign up there. Soon to be sponsored by General Catalyst. Maybe if we just say it enough, it'll will it into existence.
Maybe I'm sure that's how it works. Isn't that The Secret? It wasn't that a book, The Secret, a while back? If you believed it enough, it would really happen. There was.
I feel like no, that was The Music Man. Remember when you would imagine the music you were going to play in that movie and then play it? That was the whole premise of The Music Man.
I don't remember that.
Musical.
Oh, I should go watch that.
You should. Let's leave it there, yeah? We'll see you guys soon.